what a great way to talk about lasers that we can use, because it's so easy relative to some of the things we do in medicine and chiropractic world and now in dentistry. Low
Yeah.
level laser therapy has been around for a while. Erchonia laser is the one that I work with, and I have a laser that they've sent me, and I've been using it for post-operative pain uh, with procedures that we routinely do in dentistry. And so, for example, extractions, meaning pulling teeth, implants, placement of
Mm.
implants, deep cleanings, root canal treatment, any sort of TMJ or TMD pain, people coming in with back, neck and shoulder pain,
Mm.
jaw tightness and discomfort, migraines and headaches. This low level cold therapy, which causes absolutely no pain, very safe, reduces pain by about 45% compared to the
Wow.
placebo of LED, which is about 8%. And so that is huge, because what's the number one thing people hate coming to the dentist? Pain.
Right.
Pain and cost, right? and
Yeah.
so and so as a practitioner, if we can reduce the pain after the procedure, wow, I mean, what a wow effect can you have to be able to do that? Plus, on top of that, create some extra ROI, and it really is one of the most easiest things you could do operative in your operatory or in as a clinician, because it's just you or your assistant or your excuse me, your hygienist can just put the laser beaming at the area that you're interested in reducing inflammation and pain, or the area that you're pulling the tooth or placing the implant or doing the deep cleaning. And do it for about 10 minutes, 5, 10 minutes or so. And you should expect less pain, which means less medications and less drugs that people have to take,
Yeah.
less opioids and less Tylenol and Advil and Aleve and all this other stuff that we usually tell people to take after a procedure.
Yeah. Me personally, never having had an implant, never really for quite some time, golly, as far back as I can remember, haven't had any cavities or any fillings or anything like that. But definitely having experienced routine dental cleanings. And I can appreciate even to that, there is some discomfort, if downright pain associated when you're getting in there, when there needs to be some, like you said, deep cleaning there. And so for those listening, I'm sure kind of across that spectrum, everybody can appreciate to any degree, right? If it's just kind of more on the mild side of, you've had your teeth cleaned, and everybody can understand and appreciate and knows what that feels like after cleaning, how sore teeth can be. Or on the extreme end, if you're having surgery done, we actually interviewed recently a perioprostodontist, and he was saying the same thing. He's been using it pre and post implant surgery, and he'll do these full, just full complete. And so on that end, what a powerful tool that is for patients, to be able to just help them. And again, too, like you said, I think chiropractic to some degree enjoys, in some respects, a little bit better reception from patients in terms of apprehension or trepidation or fear. Sometimes not, if they're not familiar with chiropractic, but even people who are very familiar with dentistry, there's a whole entire segment of dentistry devoted to that, sedation dentistry, in terms of that, to help with that kind of anxiety and apprehension. And so what a powerful tool that you get to add into the mix to assist in that process.
Yeah, what's exciting about this is just creating an email and sending an email blast or an SMS messaging blast to my patients saying that we have this technology that helps reduce discomfort after a dental procedure. And
Yeah.
that is like, there's not that many dentists currently that can actually say that. So that
Yeah.
there's the wow effect. There's the show your office that you care effect. And then there's the financial effect.
Yeah.
In my courses, when I do seminars on sleep apnea and TMJ and now low level laser therapy on my website, radseminar.com, I talk about the money aspect when it comes to practitioners, being able to add, and at the end of the day, you don't even have to do that if you don't want to charge for it and to make it inclusive. You're just being a really good practitioner. You're being a caring, kind, gentle practitioner. And if patients are noticing a difference from the other dentist that pulled their tooth compared to you, meaning
Yeah.
afterwards they're not as, of course, every case is different, but afterwards they're not as uncomfortable. Man, they're gonna most likely be mentioning something like, "Hey, Dr. Rad used that laser on me today, and it was much better than when he did the one last year."